Hello everyone, this video is going to be on mobilization. Definition: it is passive, skilled manual therapy techniques applied to joints and related soft tissues at varying speeds and amplitudes using physiological or accessory motions for therapeutic purpose. In mobilization, small amplitude force is applied at fast velocity, large amplitude force is applied at slow velocity. Techniques of mobilization. First, non-thrust oscillation techniques, also called as Maitland mobilization. Second, non-thrust sustained joint play techniques, also called as Kaltenborn mobilization. These are the gradings for Maitland mobilization. The arrows here suggest how deep the oscillation goes. Grade 1. Small amplitude rhythmic oscillations are performed at the beginning of the range. They are usually rapid oscillations like manual vibrations. Grade 2. Large amplitude rhythmic oscillations are performed within the range, not reaching the limit. They are usually performed at 2 or 3 oscillations per second for 1 to 2 minutes. Grade 1 and 2 do not go beyond tissue resistance. Grade 3. Large amplitude rhythmic oscillations are performed up to the limit of available motion and are stressed into tissue resistance. They are usually performed at 2 or 3 oscillations per second for 1 to 2 minutes. Grade 4. Small amplitude rhythmic oscillations are performed at the limit of the available motion and stressed into the tissue resistance. They are usually rapid oscillations like manual vibrations. Grade 3 and 4 go beyond the tissue resistance. Indications for Maitland mobilization. Grades 1 and 2 are used for treating joints limited by pain or muscle guarding. Grades 3 and 4 are used for stretching maneuvers. Low amplitude and high speed are used to inhibit pain. Slow speed is used to relax muscle guarding. Contraindications of Maitland mobilization: hypermobility, joint effusion, and inflammation. Precautions that you should keep in mind while giving Maitland mobilization: unhealed fractures, excessive pain, hypermobility, total joint replacement, and rheumatoid arthritis. Let's start with mobilization for acromioclavicular joint. Indication: to increase mobility of the joint. Anterior glide of clavicle on acromion. Patient position: sitting. Hand placement: with the patient sitting, stand behind the patient and stabilize the acromion process with the fingers of your lateral hand. The thumb of your other hand pushes downward through the upper trapezius and is placed posteriorly on the clavicle, just medial to the joint space. Push the clavicle anteriorly with your thumb and apply the glide. Sternoclavicular joint. The proximal articulating surface of the clavicle is convex superiorly inferiorly and concave anteriorly posteriorly, with an articular disc between it and manubrium of the sternum. Patient position: supine. First, sternoclavicular posterior glide and superior glide. Indications: posterior glide to increase retraction, superior glide to increase depression of the clavicle. Hand placement with the thumb on the anterior surface of the proximal end of the clavicle. Flex your index finger and place the middle phalanx along the caudal surface of the clavicle to support the thumb. For posterior glide, push with your thumb in a posterior direction. For superior glide, push with your index finger in a superior direction. Sternoclavicular anterior glide and caudal glide. Indications: anterior glide to increase protraction, caudal glide to increase elevation of the clavicle. Hand placement. Your fingers are placed superiorly and thumb inferiorly around the clavicle. Anterior glide. Lift the clavicle anteriorly with your fingers and thumb and apply the glide. For caudal glide, press the clavicle inferiorly with your fingers and apply the glide. Scapulothoracic soft tissue mobilization to obtain scapular motions of elevation, depression, protraction, retraction, upward and downward rotation. Patient position is side lying with the patient facing you. Support the weight of the patient's arm by draping it over your inferior arm and allowing it to hang so that the scapular muscles are relaxed. Hand placement. Place your superior hand across the acromion process to control the direction of motion. With the fingers of your inferior hand, scoop under the medial border and inferior angle of the scapula. Move the scapula by lifting from the inferior angle in superior and inferior direction for elevation and depression. Scapular glide to improve protraction and retraction. Patient position is the same. Hand placement is the same. Move the scapula by lifting from the inferior angle in a forward and backward direction to improve protraction and retraction. Scapular glide to improve upward and downward rotation. Patient position is the same. Hand placement is the same. Move the scapula in desired direction by lifting from the inferior angle and apply the glide.